Welcome to part 5 of a series in the Friday Value videos that I've been covering on plantar fasciitis. And just a quick review. Part 1, we talked about orthotics. Part 2, I talked about 2 really important biomechanical functions of your foot. Part 3, we talked about the hips and how they impact what's going on with plantar fasciitis. And in part 4, we talked about your thoracic spine. And if you would like to look at some movement education videos where I discuss this topic as well and I demonstrate movements and exercises, please make sure you're checking those out. There's a playlist titled Plantar Fasciitis on my YouTube channel, okay? And also, if you don't get my newsletter, make sure you sign up for it because I just did a pretty deep dive into plantar fasciitis in my May newsletter, and in the June newsletter, I will do part 2. So, all of that said, today in this last part, I want to cover common treatments, right? Common treatments of plantar fasciitis, and you might be surprised at what you hear. So, common treatments. This is kind of where I open like a can of worms in a lot of things, right? Because there really does appear to be a real deficit in a scientific approach for plantar fasciitis. And what I mean by that is on one specific website, which is a very popular medical website, when they talk about treatments, this is an exact quote: many treatment options exist, including, and they list a whole bunch of things: rest, stretching, strengthening, change of shoes, arch supports, orthotics, night splints, anti-inflammatory agents, and surgery. And then they finish with this: usually, plantar fasciitis can be treated successfully by tailoring treatment to an individual's risk factors and preferences. So, risk factors are things like if somebody's very active in sports, maybe they're a runner, down to maybe they've got some mechanical issues in the foot, maybe they've got some structural deformities or abnormalities in the foot. But there are millions of people who suffer from plantar fasciitis. Millions. Approximately 2 million people get treated for it in this country alone. And that means there's a lot of people out there who aren't getting treated for it, because not everybody goes to the doctor when they've got a problem. They try to self-solve, right? Or they live with it if it doesn't stop them from doing what they have to do, because lives are busy, people have a lot of obligations, and life is hard, right? It can be. So here's the deal. And then the preference thing. The preference has to do with, well, am I willing to put up with that treatment or not? Am I willing to deal with that side effect or not? Am I willing to let somebody stick a needle deep into my foot, right, for an injection? And if it's both feet, I remember somebody telling me one time that it was so painful. They were literally crying, sobbing when they had to have the second foot done in the same visit, right? So is that preference? Is that what they're talking about? Or wearing a boot where you're smacking your leg, or you're hurting yourself, or you're, God forbid, your spouse, right? You're smacking them with that boot when you're trying to sleep. So preference, that's a really ambiguous term, okay? So to keep this video short, I'm just going to list the commonly advised treatments. Rest. Now, obviously, if you can't walk on your hands, if you're a runner, what happens when you start running again? So is rest really, why did it happen? Let's address the cause. Let's not just stop using our feet and hoping it goes away and then it doesn't come back when we start using them again, right? And then stretching. Now, I have seen this help a lot of people, but to have more effect from this, you really need to know how to stretch or load the muscles in all 3 planes of function, and it needs to be done weight bearing. Okay, so that's just a little tip, okay, I got to keep this short. And then strengthening. A lot of the times this is, picking up marbles with your feet. You're strengthening those muscles that are inside the foot, intrinsic muscles. They start and stop inside the foot. Well, your calf muscles and all the other muscles that go down into the foot from the calf impact your foot function, right? So how about if we work those? How about training your feet and your ankles in all 3 planes of motion so that you can regain full mobility and full stability of that foot, ankle, calf complex, right? That's going to restore authentic function. And then shoes. That could be a whole, series of Friday Value videos. But understand this, you'll get, oh my gosh, you'll get millions and millions of results when you do an internet search. Talk about a tsunami of information. The problem is a lot of shoes will address certain issues going on in the foot, but it's not it's not paying attention to what the rest of the body needs to do because of the foot function, and then how the rest of the body is impacting the foot because of how things go back and forth. It's like a back and forth communication that has to happen for proper foot function. And if you've been watching these series and if you checked out the Movement Ed videos, you'll have a lot more information on this, right? So that said, you know, some shoes might help, some shoes might make things worse, some shoes may do nothing at all. So that's kind of a, you know, you're flipping a coin or you're shooting a dart with a blindfold on, hoping a shoe will be your answer. Arch support's pretty much the same thing. It really depends on what's going on in your world. You're unique like a fingerprint. You've got to figure out what's going on with you. What's happening with the motion? Are you inverting? Are you everting? Are you pronating? Are you supinating? When you walk, not when you're just sitting still in a chair and you put your foot in a foam form. That's just a still picture of your foot. It doesn't tell anybody what you're doing when you're walking. Okay? And so, and that's my deal with orthotics, because what if the orthotic might even help your foot pain, but unfortunately, it may cause problems up the chain because it's stopping a motion the foot's supposed to have. So you really need somebody who's not just an expert in the foot, but an expert in whole body movement so that they can see what's happening when you're walking. If they're an expert in the foot, they don't know anything about what the pelvis is supposed to do, what the hips are supposed to do, what the trunk is supposed to do, right? Are they observing how your gait is impacted and all those things that have to happen are still happening, or have they been stopped, inhibited, prohibited, right? All right. I already mentioned a lot of things. Anti-inflammatories. Well, all the studies show that it's really not an inflammatory issue, even though we call it itis. There's no inflammatory cells observed during scientific studies. So treating it with anti-inflammatories, if it's not inflammation, okay, you know. And then obviously, you know, all the other reasons like injections and things, if it's not inflammation, and injections can actually increase your risk of rupturing your plantar fascia. Nobody wants that. All right, and then surgery. Obviously that, you know, whenever you do an internet search, it says only 5% of people with plantar fasciitis are considered candidates for surgery. But the surgery does things to your body that's permanent, that can't be reversed. And is the surgery fixing what's missing in your biomechanics, right? We got to think of these things. All right, I'm going to stop now because this will go too long. But I want to finish with this statement. Understanding authentic human movement leads to better training choices with improved results. And you want to make sure when you get a treatment of any kind that it's not just addressing the symptoms, but it's addressing the cause. All right. Thanks for listening. We'll see you next week.